Hey, let's talk about this newly approved drug Nafithromycin, which was approved in year 2025 in India by CDSCO, that is Central Drug Standard Control Organization. So it was developed in India. Coming to the mechanism of action, so this drug belongs to ketolides, that is macrolides, subclass ketolides. So the mechanism of action will be, it will bind to 50s subunit of ribosome. 50s subunit of ribosome, and it will inhibit bacterial protein synthesis. So this drug is basically bacteriostatic, but it can act as bactericidal at higher concentrations. Coming to the indication, it is approved for the treatment of CABP, that is community acquired bacterial pneumonia in adults. So community acquired bacterial pneumonia is that pneumonia which is acquired outside the hospital or within 48 hours of admission. Okay, so this is the indication of Nafithromycin. Coming to the spectrum or organisms covered, it is effective against Streptococcus pneumonia, it is effective against Haemophilus influenza, Mycoplasma pneumonia, Chlamydia pneumonia, and Legionella, and it has good lung penetration capacity. Coming to the adverse effects, so in trial, adverse effect reported are nausea, vomiting, and diarrhea, which is mild, and there is a class effect called QT prolongation, which is seen with other macrolides, but it is less in Nafithromycin compared to other macrolides. Rarely it can cause hepatic injury, which is characterized by elevation of transaminases temporarily. Okay, so we'll compare this drug with azithromycin, which is existing macrolide. So the main difference between these two is duration of treatment. In azithromycin, we start with 500 milligram per day on day 1. Then from day 2 to day 5, it is 250 milligrams. So total duration is 5 days. Whereas in Nafithromycin, the duration is reduced to 3 days only. One more difference is that azithromycin has resistance. So bacteria show resistance to this drug, but Nafithromycin can overcome resistance. So it is effective in resistant organisms also. So this has been achieved by side chain modification in the existing drugs. So one more difference between azithromycin and Nafithromycin is that it has drug interactions. Azithromycin has drug interactions, so it inhibits CYP enzymes, whereas drug interaction is very less in Nafithromycin. No drug interaction or minimum drug interaction. So the dose of Nafithromycin is 800 milligram for 5 days orally. So sorry, it is 3 days. 3 days per oral. Okay. So this is the difference between azithromycin and Nafithromycin. Thank you.